Fred, I'm here for book club. Looking back on chapter 2 of Political Determinants of Health, I think we must all sense how health equity efforts seem like a game, with every administration for president pushing us one step forward or one step back. Each new leader brings a shift in priorities and almost like a deck of cards getting reshuffled, but it's healthcare policies. One administration pushes for expanded coverage and equity, and the next might reverse that in favor of more market-driven policies. This constant pivot leaves our most vulnerable populations without stable access to care, and it's incredibly hard to build long-term progress on shaky ground. There's also the uncomfortable truth about who wins in this system. Our policies tend to benefit specific groups, those with the most influence, or who have the same values as the current administration. It's like we're subconsciously deciding who deserves health and stability and who has to fend for themselves. This selection process has a long history in our health policy, as it reinforces the inequalities we are trying to dismantle. The phrase perfection is the enemy of good came up a lot in this chapter, and for good reason, because we're usually so focused on crafting the ideal reform that we forget how much good a more modest, practical solution can do. Look at the Affordable Care Act. It wasn't perfect, but it opened the door for millions of people who were previously uninsured. The pursuit of perfection, the perfect reform, might sound noble, but it keeps us stuck in the mud. Incremental changes, even if they're not groundbreaking, build a foundation for comprehensive reforms down the line. We are likely nearing a moment where significant reform could be possible. I'd say I'm cautiously optimistic. The public is more aware now than they've ever been about health inequities, especially ever since the pandemic. But getting real reform depends on political courage and compromise. We need a shared commitment to do the good rather than the perfect, or we'll keep running into the same roadblocks. We may not be able to revolutionize the system all at once, but maybe the best way forward is through gradual changes that get us closer to lasting progress. Thanks.